So hello everybody. Welcome to our series of videos on public awareness. And our guest today is none other than Dr. G.V.S. Murthy. For people like me, I grew up reading his publications. He is presently serving as the director of the Indian Institute of Public Health, Hyderabad, and is also a faculty at the London School of Tropical Medicine and Hygiene. And he has several accolades to his credit, but the most recent one being he was rated as among the top two esteemed scientists in this country. So it's our pleasure to have you here at this awareness interviews of Optometry Council of India, sir. Welcome.
Thank you, Prema.
So just to begin with a question which you have done so much of community eye health, you've been such an active part of AIMS when all the need for a national program for control of blindness, etc. were set up, and you've helped run the program, I understand. So what do you see is, from your view, the biggest need today? Is it lack of awareness? Is it lack of human resources? What is the barriers? Why are our numbers for avoidable blindness still very high in this country?
Well, it's I would say it's a combination of everything, but the most important that we have to keep in mind is the sort of increase in the population size as well as longevity, which means people are living much longer, and therefore the numbers will keep increasing. And we know that most of the blindness, which is specifically avoidable in our times, is age-related. So as you live longer, the risks of going blind from cataract, from diabetic retinopathy, related to macular degeneration. So the risks keep increasing. And therefore, there is always going to be a catch-up between the need and the service that you can provide. But otherwise, if everything had remained static, I think we had done a very good job compared to many other parts of the world, where we were able to increase our cataract surgical rates nearly 7 times from what it was in the early 90s and late 80s. And if you look at from 1990s to now, there's been a 3 times increase in the quantum of cataract surgeries in the country. From about less than 2 million, we now do about 6.5 million cataract surgeries. So in terms of refractive errors, the same thing. You used to have just the ophthalmic assistants at the block level primary health centers, and I'm calling them block level because they were 100 to 120,000 population. There was only one facility that was available. We've moved a long way from that. You have a number of facilities, including the vision centers, both in the rural side, and then the massive increase in optometry services in the urban areas. So quality eye care, service delivery, as well as human resources have all increased, but you also have to keep in mind that the population has also increased dramatically. So that is where I would put it.
So it's an ongoing process. We have come a long way, and we still have a long way to go. Yes, I do also understand that in the past we had a lot of other reasons for leading blindness, like vitamin A. When I was in my college days, we would still see a lot of children with xerophthalmia, etc., which we don't see today. We've managed to eradicate. But yes, the refractive errors, which was initially not there among the leading causes, was at number 5, and now is almost moving to number 1 because cataract is being reasonably taken care of. So considering the way refractive errors has grown, where do you see how the optometrists' role in public health fits in here? If you can share with our young optometrists what they can do and what optometrists can do to the public, for the public to understand our role in community eye health.
Right. I think, the question has two major bits to it. One is, of course, what the optometrists can do themselves going forward. And the other is, if you look at the client side, which, right, what is the perception of the community? So you need to match the two together to be able to move forward. So let me start with the community perspective. A lot of times we think that people are ignorant. We've not been able to successfully get messages across. Awareness is lacking, and therefore people don't come forward for services. I think we are doing the abilities of our population a big disservice if we think that they are illiterate, ignorant, and are completely unaware of what is the actual requirement. The reality is, communities need to prioritize their needs. And in a world where you're growing up, get married, have a family, the priorities obviously are going to be more in relation to social development. You need to find shelter for yourself and the family. You then need to feed so many mouths in the family, which means that you have to go out and see that you are able to earn enough to make that happen. So that is the lever where I think we have failed to act. And that lever is to try and make people understand, look, we understand your priorities. Health is a much lower priority in your day-to-day life. But then if you have to be more productive, then your eyesight, your vision is very critical. And that is where we can help you to see that your productivity increases and you're able to see that the needs that you prioritize are taken care of better. Even within the health sector, you will obviously have conditions which have a higher mortality, which will be scaled up and provided more support by the government. Specifically, so in this year, when you see the COVID outbreak and you see millions die around the world, so governments would therefore give first priority to conditions which lead to mortality. And there we obviously in the eye care sector fall behind in terms of that particular priority. But we have to realize that unless people survive, they will not have eye care needs. If everybody were to die in childhood, you would hardly have any myopia presenting. If everybody dies in their early 40s and late 40s, then most of the eye care needs are not there. And therefore, we need to understand that we have to work together. And today's optometrists have to understand the importance of coordinating, collaborating, partnering. It should not be that, I'm a single person, I provide this service, this is the way I take it forward. That is not going to work. Even if you are not part of a team, the philosophy of a team where people working at different places come together to meet the same objective is very critical. You may be in your own clinic, but at the same time, you also have to realize that there are other health problems, there are other development problems. Let me work together as a part of the overall development agenda. I think that is actually going to make a big difference. The other thing that is also important is information sharing has to be bidirectional. It can't be that you just expect a referral to come to you, you finish the treatment, but then don't provide any feedback. The moment you don't provide the feedback, you're breaking the loop. So you're breaking the trust. So people will come and work with you if you are willing to complete the loop and add to the trust in the provider perspective. I think that is very, very important for all the new generation optometrists to remember. The other thing that we also need to keep in mind is the fact that when we are looking at enhancing awareness about eye problems, there are two major things that you look at. On the one side is the mass media, and the, uh, the the entire polio campaign was just based on those do boond zindagi ke, so
So,
that made such a massive impact. So it was a simple intervention which was marketed and presented very well. We also have some excellent interventions in eye care. Spectacle, the need for so many millions in our country, and even a surgery like a cataract surgery is something which is affordable and can be brought up to the secondary care levels in most parts of the country. But are we getting a message like that in the mass media, like the polio elimination or eradication program did? So that, I think, is something the new generation needs to look at. How do we innovate? And the innovation has to be not just in terms of service delivery, but also in terms of how technology can be used to inform and educate. The other aspect is interpersonal communication. When it comes to anything to do with healthcare, believe me, mass media only plays 30% of the role. 70% is through
yeah,
interpersonal communication. And you have to become a good communicator. Optometrists need to come forward, learn the skills of communication, find the messaging, fine tune their messaging so that they can convince people on why they need to take the service that is available to them. If you don't do these roles, you have to be a communicator, you have to be a provider, you have to be a counselor. So you have to be Aunt Agony as well as Superman or Superwoman, all rolled into one. Those are the sort of roles that the new era optometrists should look at. Engagement with community-based organizations, that again is very critical, that you have not just the bigger clubs like Rotary or Lions, but also you have very small community-based organizations of group of youth or group of women. You have the self-help groups. It's important to start engaging with players with whom we have not engaged in the past. Also, with an increasing geriatric population, and many children coming into school, unlike your time or my time, Trina, where 70% of children were out of school. So now that is not there. People are in school
yes,
and people are growing older. So we need to look at how do we reach or engage with the schools and with the elderly communities. Maybe they're staying in old age homes or are within regular residential communities, complexes. How do we reach to them so that their eye care needs can be provided for is again something that the modern day optometrist needs to look at. Ultimately, it is your skill which ensures quality, which brings in the reputation and brings in people to you for service. So you have to be sure that you are looking at enhancing your clinical skills, attending CPEs, attending the skill workshops so that you're able to improve that becomes very, very critical. The final thing that I would say that today's optometrist needs to do is to realize that there is a task sharing responsibility that all health providers have. Don't think that you are the only person who has to do everything. If you share the task, for example, just getting somebody to record the vision, by training somebody in the community, they can actually be your ambassadors. So try and use whatever can be afforded from the community and look at your clinical skills, topping it up from there onwards so that everybody works together for the betterment of the community. So that would be the way I would look forward to today's optometrist.
lovely. I think a lot of great messages. that our optometrists need to collaborate, coordinate, partner, communicate. I think very, very brilliant messages to our optometrists who are practicing, who are working in whatever setup, hospitals, optical setups. I think these are very brilliant messages that are going to them. And I think, as you said, it's very important to have teamwork so that we reach out to patients and tell them. And I agree with you that patients are aware, but their priorities are different, which is what some of the studies also say. Food, shelter being their priority, and even among healthcare, I think eye is given a little lower priority than other healthcare. Right? So, Optometry Council of India is honored to have you because we get such powerful insights from you to make optometry better, and it's so much of validation when it comes from somebody your level. We truly appreciate the time you've given us, and we do hope this interview goes a long way in changing the way optometrists practice, schools teach community eye care, and deliver services. Thank you so much for your time, Dr. Murthy.
Thank you, Prema. Thank you so much, and have a great day ahead.
Thank you.